Hello, everyone, and welcome to Elixinol's weekly program talking about cannabidiol and how it'll work for your health. Today's topic, that's sponsored by Elixinol, is about how does CBD work? And I want to talk to you about how it enhances health and it improves wellness, as well as it approaches some disease and conditions. Now, let me remind you about cannabidiol, that it's an oil that comes from hemp, and it's CBD that really makes you healthy and not high. When we're talking about hemp, we're talking about the difference between marijuana and industrial hemp, and the difference there is quite a bit in terms of the content of THC. So CBD is the healthy side of cannabidiol, of the cannabinoids, and that's what makes you truly healthy, and it doesn't make you high. There's no psychoactive effects. And you'll remember that cannabidiol is safe, it's legal, and it's effective in a broad range of conditions. Now, cannabidiol causes no significant reactions, toxicity, or interactions, and so that's really key to your use of CBD as a patient or as a provider in helping other people work through the uses of this novel substance that's been around for at least 4,000 years. So let's go down to the really core point. How does cannabidiol work? How does this substance have so many effects? Well, number one, we know that cannabidiol restores the endocannabinoid system. So one of the things we talked about in previous sessions was this broad-ranging control system within the body called the endocannabinoid system that deals with a lot of subtleties and helps make other systems work, like the immune system and the neurologic system. Well, what we've seen is that there can sometimes be dysfunction or deficiencies in the endocannabinoid system that lead to imbalances that cause some loss of homeostasis. What we're seeing with CBD is a mechanism that restores the cannabinoid receptors, the natural ones, the endocannabinoids that we have in our body, as well as receptors, and balances them out again, as well as some of the other substances that are involved. It's working on the receptors. Now, classically, we're talking in terms of the endocannabinoid system as the CB1 and the CB2 receptors, but that's just a small part of the number of receptors that cannabidiol is connecting to. And the range of actions has been from as an agonist or an antagonist and even a reverse antagonist, so fairly complex. Not only that, CBD can interact with some of the other receptors like opioid receptors, but it does it in a very unusual pattern in that it's working from the cannabinoid receptor to the opioid receptor and forming a bond there that makes regulation and modulation of that receptor. So it's not just black or white, on or off. There's subtleties to that allow for fine-tuning of the body's entire hormonal system. In addition, cannabidiol is working on the enzymes of the body, and that particularly are involved with the endocannabinoid system. So by blocking some of these degradation pathways, then, and I've listed a few of them off here, it raises the levels of the natural endocannabinoids that we have circulating in our body. And when we resist, when we raise these particular levels, then you're getting an added benefit. But cannabidiol doesn't do one thing on it. They're fine-tuning adjustments, and so that they're just making the body get back to normal, to rebalance. It's not like it's going to overshoot and cause problems. And that's one of the problems that the pharmaceutical industry has, is that they'll develop a product and it'll only work one way. That's it. That's the end of the story. It's only one process. And so if they block one of these enzymes, then it's blocked, and it's blocked as completely as they can. Whereas cannabidiol regulates some of these processes, so it's a balance change that occurs. Now, these are the enzymes that are involved with the degradation pathway of the endocannabinoids, but it's pretty clear that CBD is involved with some of the synthesis molecules and enzymes that are making up more of the endocannabinoids and some of the other substances that are used as signaling components in maintaining homeostasis and keeping our body in good function. In addition, cannabidiol is working on some of the transporters. And this is a little bit different and unusual. What we're talking about is how do we get these cannabinoid molecules around within the cell into these different processes, whether that's the nucleus or even within the nucleus, or it's the nuclear membrane, or the Golgi apparatus, or endoplasmic reticulum. How do these molecules move around? And that's where we're talking about transporters. And there are specific transporters that are involved, and cannabidiol is playing a role in terms of raising the levels and the number of transporters, making them available. One other area, too, is interesting is within the synapses of the nerves. What we have is cannabidiol working on the vesicles and encouraging and potentiating the release or the inhibition of some of those chemicals that are accumulated in the axon and released to go across the synapse to the dendrite of the other nerve cells. And so by regulating those things, you can see how fine-tuning that CBD could be in this complicated process of regulation and maintaining homeostasis. So if we were going to look at some of the mechanisms, I'm naming off a few of them here, but what I've done is I've gone through the literature very carefully, and I have looked at this point in time, I've identified at least 52 mechanisms that are involved in this process, where cannabidiol is taking a direct or an indirect action. So I realize you're not going to be able to read this slide, but here are a good portion of the 50, these are the 52 mechanisms that I've specifically identified. Now, what I've done is I've created this document, and it's available on Google Drive, and I'll have the link at the end of the program. What you can do is you can see the individual mechanisms. I also realize that some of these are redundant. I may have repeated them in some different words, but these are all true mechanisms, and you can see the wide range of where they're working. Now, you understand that these mechanisms are working outside the cell, inside the cell, between cells, within some of the organelles of the body, including the nucleus and the endoplasmic reticulum, as well as the mitochondria. So we have a rather promiscuous molecule that can go anywhere and make changes to the body and how it's functioning. What's marvelous to me is the ability for cannabidiol always to do the right thing. Whatever the optimum care that is involved, or what would idealize the performance and the function of the body, that's what cannabidiol is doing. And so rather than giving anybody an extreme effect, such as a Superman or a Superwoman, it's really working to normalize people. And for people who are already normal, well, that's not much of a change for using cannabidiol. But for many of us who are impaired in one way or another, this is a big deal in turning back the clock and restoring ourselves to some better function. Now, so these are all the mechanisms. I just want to go over where they're working and exactly what places that you see cannabidiol functioning. So we know that cannabidiol works on cell membranes, but that's not just the outer membrane of the cell. That's also some of the inner membranes, including the mitochondria and the nucleus. There are actually functions for cannabidiol and regulation. Sometimes it is the thickness and the chemicals, the lipids that are populating those membranes, and sometimes it's working through some receptors that are allowing the transmission of some electrolytes like calcium or magnesium through those particular membranes. So membranes are a key point, but that's not the only thing, because they are also working on those other areas and working within the cell separately as a signaling molecule. Other places that we see cannabidiol working, the neurologic system. Now, classically, we have said that CB1 receptors are in the brain and CB2 receptors are in the peripheral portions of the body, typically the immunologic system. But frankly, that is pretty well mixed up. I think that's a broad generalization, and you can't entirely rely on it. We do know that there are cannabinoid receptors and transmitters that are located in the synapses of the nerves, wherever that be, whether it's the spinal cord or the peripheral nerves. Those things are going on there. Furthermore, we just mentioned that it's involved with the immune function. So we're talking about a complex regulation of the immune system, including not only the cytokines and the release of inflammatory substances, but we're also talking about the cell populations, whether they're macrophages and the T cells that are involved. One of the ways the body regulates inflammation is by controlling the cell type that's there. It's very clear that cannabidiol is controlling a lot of those macrophage functions that occur in the periphery and in inflamed areas, as well as the glial cells that are in the brain that control a lot of the inflammation there. In addition, we've got so much in the way of neurotransmitters and neurologic function, but we also have a hormonal function. The gut is another prime area for cannabidiol. Just today, got feedback from a 10-year-old child with Crohn's disease who has gained in the last month on cannabidiol 15 pounds and is complete clearing of his gut. And that's just with Crohn's disease, and that's just in a matter of 3 to 4 weeks. Incredible results from that. In addition, we're seeing cannabidiol working on the endocrine system. We're talking about regulation of the pituitary axis, the cortisol, and the sex hormones are involved with this. They're subtleties, but cannabidiol is involved with those, enhancing those and improving the functions that are there. We know specifically that cannabidiol has controlling mechanisms on the cortisol and improves and rebalances some of those levels in those chronic stress situations. And finally, but not last or not least, the cardiovascular system. There's pretty clear evidence that cannabidiol is involved with some of the inflammatory pathways, able to reduce the inflammation and even probably reduce atherosclerosis and stop the process that's going on in the vessels around the heart, as well as protecting the heart against major injury. So you see a broad range of mechanisms that CBD has for affecting the body and improving the body, where at the same time we're not seeing really any significant adverse effects or toxicity for whatever dose that people are using. So as we bring up dose, let's go back to the primary, the user's guide to cannabidiol in terms of how to dose patients and what I generally recommend. I think that 15 milligrams twice a day is a great starting point for just about everybody. Now, there are some higher targets when you're dealing with a great deal of inflammation, but if you follow these guidelines to match the product to the preference of the patient and also to make adjustments early and rapidly, then I think whatever dose that you start with, then you can move up quickly. You shouldn't really wait longer than a few days to make any changes to the dosage on the cannabidiol. And it's good for patients of all ages, all conditions, in illness and in health. And I emphasize the health portion because you want to stay healthy, you want to prevent disease. This is a great way to go, cannabidiol, using the protection and the protection features that are contained with cannabidiol. And finally, if you need to learn more, if you'd like to find out more about cannabidiol and some of the resources that I've identified, as well as take a look at that white paper that I've done with regard to cannabidiol, and the mechanisms, you're welcome to take a look at these particular things and this particular link. Take a look at that, and it's a work in progress. So I'm hoping that I'm going to add at least a dozen more mechanisms as more and more literature comes out, and we can find out more about it. Well, that's all I have for today, but be glad to answer any questions if anybody has any questions at the present time. I'm going to unmute everybody, so you're welcome to Well, actually, I tell you what, I'd rather have, if you have a question, to put a question in on a chat box, and then we can get that information. I can take your question and see if I can get that answered for you. So one of the questions I frequently get is, what about pregnancy and breastfeeding? Well, we don't have very good information. Most of the papers and the studies that have been done on cannabidiol specifically have not gotten into detail. They certainly haven't addressed breastfeeding or pregnancy in general. But we do know from some marijuana studies that were done on pregnant women and followed that the children of women who were smoking marijuana or using marijuana in a regular fashion during their pregnancy had no adverse outcomes with their children. And their children were followed up for at least 5 years. In fact, there was some evidence that the children were actually better socially adapted than the control children, or the ones who had not been placed on or were not using any marijuana substances. So I don't mean to advocate for marijuana or not to advocate for marijuana, but I think when you look at pregnancy and breastfeeding, you have to think about, well, if somebody's ill and they have a great deal of pain or suffering, and what's that patient going to be directed to use? And if it's not something that's healthy, then that actually the cannabidiol is probably going to be safer than some of those other chemicals that they might use in hopes that they'll control their particular symptoms. Whereas there's no evidence that cannabidiol has been shown to have any adverse problems for any other conditions. In terms of breastfeeding, again, we just don't have enough information. And would cannabidiol have an adverse effect with children? We just don't know. We do know that the endocannabinoid system is very active in breastfeeding and in pregnancy, and it's a natural part of the process. And based on the track record for cannabidiol, it's very unlikely there is any adverse association with using it. But I really can't, I don't have enough information or evidence to advocate for the use in pregnancy specifically. How fast can one begin to feel the effects of cannabidiol? Well, actually, the effects can be felt almost immediately. And I frequently will have clients call me and take a dose while they're on the telephone. Immediately, they'll have relief of anxiety or an elevation of mood. I can frequently tell that they've taken it by seeing relaxation in the face, and they're also talking faster. For some people, their voices deepen. That includes women. So there's a fuller, stronger voice that comes from them. So you can see changes within minutes after some of the dosing that when it goes sublingual. When we're talking about dosing with capsules, it takes a little bit longer, on the order of 1 to 2 hours, to get the effects of the capsules, which are typically about 15 milligrams. But other than that, you ought to see the results quickly. And you can also use it topically. And in that situation, I see within about 10 minutes, people are getting relief, analgesic relief from injuries and trauma that they've had. So another question here is there anyone who should not be taking CBD? Well, that's a good question. And I'm having a hard time struggling with it. I guess the usual answer is, well, if you're allergic to it, that would be one thing. But I haven't really found anybody who has had a true allergy to it. Some people have reacted to sometimes the flavoring, or thought that they were having a reaction, but it wasn't consistent, nor did it return. In terms of young people, we've used cannabidiol, and I've monitored people who have been as young as 2 years of age. And I wouldn't myself hesitate to encourage patients, parents of children, young children, to use the CBD. In which case, I will usually start off with about half the dose that I might recommend for an adult. So instead of 15 milligrams twice a day for a young child, I might do 7 milligrams twice a day. And then the frequency can change as well, so that changes. Now, for seniors who are over 70 years of age, sometimes they're particularly sensitive, and so you may want to start on that half-dose schedule as well until they're confident that they are going to respond well to it, and they're not going to have an over effect. The over effect is sometimes with some fatigue that can be associated with it. How frequently should CBD be used? Well, what I've seen is that 2 or 3 times a day is a great pattern. But really, what you need to do when you're using cannabidiol is adjust to the needs of the patient. So if they're having quite a bit of pain, we'll increase the dose until you find exactly what the right dose is. But whatever that dose is, you want to see, number one, will cannabidiol be effective? Now, it's effective in about 75–80% of patients for pain, but that's not everybody. So one of the things that you should do on your initial trials and during the early phase is find out what dose is effective and if it's going to be effective for them. So run the dose up very quickly in order to get those effects and those benefits, and that encourages the patient as well as you. And then because there's no significant side effects or adverse effects, you can be confident that there's nothing serious that's going to happen for the patient. And the only challenge is, will you find the right dose? And then once you've been on the right dose, a patient's been on the right dose for a considerable period of time, maybe 1 to 2 to 3 months, then they may be able to decrease the dose significantly. Because unlike other substances, cannabidiol doesn't develop a tolerance. There's actually an improvement in the effectiveness, so that as little as 1/4 of the original dose or the starting dose is necessary or is available that can provide the same effects and the same results. In future programs, I hope to be talking about inflammation and neuroprotection, as well as other aspects, pain and analgesia, and how cannabidiol is especially targeted for some conditions. And I already mentioned today about inflammatory bowel disease, which we have superb results for. So that's the program for today, and I would I plan to come back on a weekly basis, except next week is going to be a holiday, and so we won't be available at that time. So the next meeting, the next webinar is going to be the 1st of December. Great. It was good talking to you, and I hope to provide more valuable information about cannabidiol at our next meeting. Thanks for listening.